Now, this is the sagittal section of the testes. You can see the microscopic view. You must know that testes, they have to do two main function, or it has to behave as an endocrine organ and exocrine. Being endocrine organ, it has to produce hormones like testosterone. The other function as exocrine, it has to produce the germ cells. For this, we again concentrate now towards the previous diagram. Now you can see next to the layers we were discussing the tunica albuginea, and now we mentioned that it becomes thicker towards the hilar region or mediastinum, and it gives rise to thin septa and dividing the testes into small compartments. You call these as testicular lobules. They are almost 250 in number. These small compartments you can see. Now see, these compartments holds highly convoluted small seminiferous tubules in it. These seminiferous tubules on their both sides has got the interstitious connective tissue, or you would say intertubular connective tissue, and here near its margin this connective tissue is having the blood vessel in it called as tunica vasculosa, and this interstitious connective tissue is well marked in addition to its regular fibers, ground substance, and the fibroblast like cells, collagen fibers. The main thing that it carries in, you can see again a cut section of this seminiferous tubule. So many lumen you can see, either obliquely set or very rounded or oval shaped. So many cut section of the tubules you can observe. Now take another view, a larger one of this in between area between this tubules, the interstitium. Here you observe a special type of cell called as Leydig cells. The Leydig cells basically are to produce the hormone called testosterone. They are typical steroid secreting cells because they are well laden with the lipid droplets. Abundantly mitochondria is present over there with the tubular crusty. Then there is a well developed, you would say, Golgi apparatus is there. Then abundant smooth endoplasmic reticulum is also inside these Leydig cells. All these features support that these Leydig cells are typical steroid producing cell, giving intense eosinophilic tinge to them. They are present around the seminiferous tubules cut section or lying in the interstitial connective tissue of the testes. Now we have to move towards again to the first diagram where we can see how these tubules are lying. These seminiferous tubules, when we see its cut section, we see it is lined with the specialized type of germinal epithelium. This is known as stratified cuboidal epithelium. Near its exit, they becomes taking a straighter course. Now this straighter course, here they are called as, a special name is given to them as the tubuli recti. I have to mention this straighter portion called as tubuli recti. In its very proximal part, they are laden with the sertoli cell we will discuss later on. And its distal part, they are lined with the simple cuboidal epithelium, lined with the short microvilli inside and single kinocilium. Then you see there is another network of small tubules in the mediastinum. This is called as reti testes. Here, when you cut them, you see the epithelium made up of simple cuboidal epithelium, lined again with the short microvilli and the kinocilium. Now, can you see there is another collection of 10 to 20 or 10 to 12 efferent ductules taking exit from these reti testes as efferent ductules or vasa efferentia or ductuli efferentes. 2 to 3 names are given. The thing same is E, the efferent or efferentia or efferentes. They are going to join the duct of the epididymis, again E. So we can memorize that the efferent ductule starting with the E are ending in the E, the duct of epididymis. And what is going to happen, that these tubuli recti starting with the name used being inside recti, are going to enter into the vasa recta. Again, a word these tabula recti are called as vasa recta, and they are now entering into the reti testi. The word R is again repeated just to cram that the tubular recti are entering into the reti testes, and they are exiting as efferent ductules into the duct of epididymis. Now we have learned about its epithelium. When we cut this efferent ductule, a special thing we will observe here: the epithelium becomes simple columnar, but not in a regular fashion. Few cells are tall columnar, lined with the cilia, and some cells here are of low columnar or low in height, lined with the microvilli. Then they join the duct of epididymis.